Well, thanks, Justin. Thanks for inviting me. Look, my personal story in the beginning is the experience of using Renew 28, the gel. So I was a practitioner who was wearing down. My hands were literally wearing down because I wasn't able to even make a fist and clasp my hands together. I had a lot of joint issues, a lot of inflammation. And I trusted a health professional, came to me, a colleague came to me and said, I know you're having some issues with your thumb. I know you can't bend. I couldn't bend my thumb. I couldn't do this technique with touching my fingers at all. It just wasn't working. So that was really affecting my being able to work in my clinic because I'm hands-on. I wasn't able to hardly touch anyone's feet, hands or ears or do any reflexology at all without discomfort. So that's where I was up to. And she reached out, she said, I think you should try it. It's a beautiful gel. It's really clean. It's non-toxic. It's really safe. And to me, the product looked like a skincare product, which, you know, I know now definitely is, but then I didn't know how it was going to work. But I started applying it quite liberally and I had a result within a couple of days. I had a reduction in discomfort and that product saved surgery for me. So it was expensive surgery. It was time out of my clinic that I was going to have 3 months out of my clinic all up. And so it saved me doing that. And from that point on, I was a believer. I was convicted. I started using it on so many other things to do with myself, obviously my skin. I had a hip issue. I used it on that as well. And really quickly, I'm not a practitioner where I would sit and wait for 3 months to see what's going to happen for me. I started getting it out to clients who were open and willing and were wanting to get improvements with their health. So I started getting it out to them. And just over a really short period of time, started to see some changes with them, with reduction of inflammation, people with leg issues. Being a reflexologist, I see a lot of poor circulation in people's legs. I started to see huge improvements with people with that. So that got me really retailing the product. I guess I was retailing the product, and that's what I knew to do because that's what I had done before. I'd retailed product to people, but this was something really different, and I'd never been in this model before. So for me, it was new. I'd worked in government. I've been a teacher, and I've been a sole operator, and that's very lonely. As you said before, you're very much alone in what you're doing. And then I was introduced to the team, to Justin, you and Nicole and Sally and other people in the team. And I felt that it was something I wanted to put my heart and soul into. Then I realized there was this phenomenal company and they would support me and train me and give me all the things I needed to do to help share this incredible technology. And you know, our family really needed this technology. It's been life-saving. It's saved my partner from further terrible treatment and so on. So, you know, we really needed it, and we really also needed to be able to pay for our product. And I could see that there was a way to be able to do that as well. So just incorporating it with the clinic, I introduced it to a very big medical centre here in my local area of 100 staff. And to this day, they still retail the products. That's 5 years of them retailing a product, getting it out to people in the local community, which has been awesome to see. And so, you know, just over time, over the last 5 years, working with ASEA, with the culture, being able to meet the founders and, you know, travel overseas, see the production plant. I mean, seeing the production plant in the States is just phenomenal to see the scale of what this is and where this can go. And you just know that if you're going to be involved with something like this, it's got a future, it has got a legacy, and it's going to be around for a very, very, very long time. And I wouldn't partner with something that wasn't going to be. I wouldn't partner with something that wasn't going to be able to help people and solve solutions. And, you know, to this day, I'm like you, Justin, I'd never go off the product. I'd never stop talking about it. I'd certainly never stop sharing it. And I know now from what I've gone through last year, with being locked down and the clinic not operating for 3 months, I still had an income. And I'd never had that before, because if I ever took time off or had holiday, I didn't actually have income coming in. So I really saw the benefit of having that, you know, plan B, or having some other income coming in apart from what I was doing in a clinic situation. So, you know, I definitely think if anyone's looking at this, definitely to start thinking about incorporating this in to your practice. Just get it, try it. It doesn't hurt anybody. It's completely safe. And then, you know, if you want to do something more with it, definitely talk to some people who can help you and train you and show you how this can be of great benefit for you financially.